Hey everyone, it's Donna and Debbie. How are you? We already have somebody here from Minnesota Sheltie Rescue.
Ooh,
Um, Although it looks like she just posted earlier below. But anyway, so we are here. I am getting some feedback. Are you getting feedback?
no, I'm not. I'm using with my headset. It's perfect.
Okay, good. Anyway, I want to introduce you to Debbie Jacobs. She is the author of a guide to living with fear with a guide to living with and training a fearful dog. And she's also a CPDT-KA, and you're going to explain that to me, and a CAP, right? Did I get that right?
Good enough, close
Okay.
enough. And I'm happy to talk to you about that stuff. Now,
Yeah.
hey, I've got a question for you, Donna. I've put some stuff in the chat.
Mm-hmm.
Is that showing up? Can you see it? The team
Um,
chat?
oh, did you go to, let's see. Let me see if I have it
Well,
in
only
here.
because I put up a couple of links that folks can. One is a link to Sunny's story, the dog who's on the cover of the book. And
Uh-huh.
then I also did some shameless self promotion and put a link up to where people can get the book. So
Well,
just checking.
yeah, and I actually have you up. I have fearfuldogs.com is the website. So I don't see it right now, but I can actually post it, and let's see. So I'll post it here. Um, and if you could send me other links that you want.
Well, I put them in the team
Oh,
chat
you
box.
put it in the team chat box. Okay, got it. I have it here. That's our private chat.
Oh, is it
Okay.
okay? Well, I
Yeah,
wasn't
yeah, yeah.
really.
No,
I,
no,
I
that's our private chat. So I'm gonna post it so that people will see it. Great. And then okay, so that's Sunny's story on YouTube.
yep.
And then here, I think I posted it twice. That's all right. And then we've got the fearfuldogs.com books. And so just so you know, there's a little bit of a lag here, so you won't see it right away.
Okay.
But yeah, it's on the Facebook page now, so we've got it. So anyway, I want to introduce everybody to Debbie, or introduce Debbie to everyone. But first, I want to tell you how I got started, and it's kind of similar to what Debbie's done. In 2008, my father adopted a dachshund, which he should be coming running in here at any moment. And his name is Rudy, and Rudy came from what is known to be the largest, or one of the largest, puppy mill raids in history. There was over 1,000. There was over 1,000 dogs that were rescued, and they were mostly dachshunds and Shih Tzus and Chihuahuas. And so my father had him for about 4 months later. My father ended up in the hospital, and hence I got the dog. You know, that's a typical story a lot, is what I'm hearing. And what I realized is that this dog was so fearful. He would sit there and shake. He wouldn't come to anybody. It took him a while to warm up to us. And I thought I was doing the right thing by taking him around to all my neighbors and having them pet him, because he was a little thing, so I could do that. It wasn't like a big dog that would run away. And I thought, that would socialize him. I took him to regular dog training classes, which he did great the first session. Then the second session, he started shutting down. Third session, he couldn't do it. We had to pull him out from class. And that's when I realized I was doing things wrong. And I came across a friend of mine who was a dog trainer who specialized in fearful dogs. And I decided to start a meetup group, because I looked everywhere online in 2009 and there was nothing. There was nothing available for dogs like this. They were pulling all these dogs out of puppy mills, and there's no training for them. So I started this meetup group. We used to meet in person. She ended up moving away. And then I found Jenny Grant, who has been with me ever since, God, it's like almost 10 years now. And we have conference calls, and she does great work. If you guys ever need any help, please contact me. I'm, happy to send you to our website, because we have a very private website, and it's a free once a month call, and she works great with people. So anyway, back to Debbie. It's sort of similar of what we went through. I wasn't a trainer at all. You were a hobby trainer, is that right?
Well, I'm not sure if that's the terminology that people use. It's basically, I was interested in training my own dogs, and so I took my own dogs to training classes, and I volunteered at a local shelter, and fostered dogs, and had begun connecting with groups in Puerto Rico, and I did work with, bringing dogs over, Satos, and so that was, so I trained them. I had my own dogs, and I went to classes, and I did what you do in training classes, and I was really lucky because I'm in the Northeast, and we have some really good trainers, and we had trainers at the time who knew to use food to train dogs.
Mm-hmm.
Oh, hi, Amy. Oh, that's nice. I see these little messages. Oh, that's great. So I'm seeing folks from my Fearful Dog group on Facebook. That's really nice. Thanks for saying hi.
And Carolyn Hayden said hi. She was probably at one of the talks. And then we've got Ellen Park Mork, who also says hi.
Oh, good. Well, thank you all. Hi, all back in general. I appreciate. I do see your hellos, and if I don't say hi to everybody, it's because hellos are coming at me fast and furious. And so that was how I started off. And then when I, in 2005, after the hurricanes in Katrina and Rita down in Louisiana and Mississippi, I went down with my shelter manager and her daughter to go do some volunteer work at one of the rescue sites where they did a lot of triage and brought the animals in. And so I was there, and that's where I, saw this dog. I saw Sunny, that black and white dog, and sort of looked like a border collie, and I had a border collie at home, and I thought, oh, jeepers, a border collie, should bring him, he shouldn't be here. Not that any of the dogs should be there, but we all sort of have certain breeds and certain faces and certain looks sometimes sort of tug at our hearts, and we know we have to be careful about that, because that dog who looks just like our childhood dog is probably not anything like our childhood dog. But we bring him home. And that was sort of what I did with Sunny. And when he came home to me, much like what you discovered with your little Doxy, I realized that this dog he wasn't responding the way that I thought a dog should respond when they live with me in doggy paradise. And so, like many people who do end up getting into training and learning more, it's because we sort of meet this dog, and everything we thought we knew and tried to do isn't working. And, what you explained, with your 3 exposures.
Yeah.
Basically, now that I know more than I knew then, realize that those first 3 exposures are some of the most important exposures. And at that period that we have for these first exposures, we can make it or break it. Those are, with people, we say first impressions count. And really quite literally, the studies show that it is the first impressions, those first 3 exposures, that are the most important. And we know that, the first exposure is like, oh no, what does this mean to me? Then the second exposure again, what does this mean to me? And they're either discovering, wow, this is fabulous, I love this, or, oh no, this isn't safe, I'm scared. And then now we've dug a pit and we're in it with these dogs, and now we're going to try and get out of it. And if we're going to get out of it, we can't rely on just all the sort of stuff, the DIY that worked with the dogs that were, weren't puppy mill dogs, didn't suffer from some kind of deprivation or neglect or abuse or trauma, that were resilient and tolerant and could basically, come around. We now have this dog who I say, sort of fallen off the edge of the cliff, and now we're trying to drag them back up. And if we're going to drag them back up, we really have to be sort of like on our game.
Right.
With these dogs.
Right way. Yes. Not the way that I tried to do.
Well, or that any of us, it's not just you. I mean, we all make the same, well, not everybody, but many of us have made the same mistake. So for lots of trainers, Sunny was that dog that said to me, "Hey, girlfriend, you think you know what you're doing? You don't know squat. You need to know more. If you're going to help this dog, you need to start learning more about how behavior works and how animals learn." So that was, in that way, yes, Sunny was sort of my, my catalyst.
So, so how long, because I get this all the time, like how long with my dog, it's a constant, I mean, he's like 90% there, but every once in a while, even after 9 years, 10 years, he still has a shutdown moment. Is there a point where, I mean, I guess each dog is an individual, so everybody's different, but is there a point where you feel like they can be turned around, or?
Again, like you've already answered the question. There's different reasons why animals are fearful, and they are impacted. I mean, this is one of the things about puppy mill dogs, and I just want to say before I don't say it, forget to say it. I think what the work you do and the focus that you have on puppy mills and helping these people is just a fabulous thing. And that I know that you're out there doing this, and I know Jenny, and I think that what you folks are doing is so important. Thing about puppy mill dogs, anybody who knows anything about the way animals develop would no sooner buy a dog that was born and bred in a puppy dog, and I'm not saying rescue or whatever, but people who are going to pet shops and buying these dogs, or going online and buying dogs that were born into a puppy mill. It would be like buying a car that was assembled by a bunch of frat boys on a Saturday night. You'd say, I'm sorry if I got any frat boys out there, and I'm making gross generalization about frat boys on Saturday nights. But the point is that these dogs, because of their early exposure, are not, doesn't mean that some of them don't have better genetics, but we know that what they experience before they're born, what their mother experiences while she's gestating these puppies, what they experience in the womb, what they experience immediately after they're born, what they experience in those first few weeks of life, basically build the brain that they need to have to live in the world that they're going to live in. And what world are these dogs in? Well, it varies. Some of them are in the most horrible, deprived conditions. They're stuck in cages. Some of them are, we know that it runs the gamut. I mean, puppy mills, wherever, whatever, or whether it's
backyard
breeders, hoarders,
right,
whatever. Those first, all of that builds this brain. And it is really amazing to me how far many of these dogs can get. And I think that, that we don't have any way to know, because so much of it, because we don't know their history. Right. We don't know their genetics. We don't know what they were exposed to. And
I were talking about that earlier today, about how when they're coming in through shelters, we don't even, we don't know where they came from, because people lie about when they drop their dogs off, or they don't tell us what, and so they could be puppy mill dogs and we don't know it.
Right. And so without that information, it's really impossible. I mean, the one thing that I will say is that, change is always possible. Change is inevitable. The question is, it's what we bring to the table. It's what the dog brings to the table. And what the dog brings to the table is there. We get the dog. What we bring to the table is what we can change and we can improve on. And that's sort of where I'm coming from, is to help people understand that if we are going to help these dogs, if we are going to roll the dice or stack the deck for these dogs, how can we do it to make it more likely, more, set them up so that they have that if they're going to improve, we give them the best shot at it through the way that we handle them, the way that we train them, the way that we treat them, the medical treatment they get, the behavioral treatment that they get. And because that's, and this is the work that new owners, foster caregivers, people who are taking care of these dogs while they're in rescue, if a rescue doesn't, keeps their dogs in homes. These are the people who, to me, are gold. When I can, and I hope if you're out there, if I can get this information into the brains of the people who are the first, the people who get these dogs, every interaction, every situation, every event matters to these dogs. And if we understand how it matters and what we need to do, so we don't, a lot of us go through that, like what you mentioned. It's sort of I call it the suck it up and deal. Oh, look, you're going to have to deal with this. So just do it. Let's get you out there. Let's get you exposed to things. You're going to have to live in a house. So here, you're in a house, live with it. You're going to have to go for rides in the car. So here, go for rides. I'm going to take you to classes. And if we understand that the impact, the negative, things that can happen when that's the way that we think about behavior, it can just go wrong, and how it can go wrong. So when I think about it, and if I have my Fearful Dog group folks out there, they know I sort of drill this home. I think about it there are three, I call them steps. I mean, they're not necessarily that we do one and then the other, but they're the guidelines. And the first thing is that the dog needs to feel safe.
Right. I don't want to interrupt you, but I do have a couple of people that are on the conference call. I just want to make sure that they can hear me. Can you guys,
okay, sure.
Can you guys hear me okay? Can you hear everything okay on the conference call?
Yes, Donna, yes.
Oh, good. Okay. I'm going to mute you so that we don't get feedback. Okay. So, but if you, we're going to open it up in a little bit for questions. So hold on just a moment. And then if anybody else has questions, please post them below. Okay. So that we can answer. We do have a couple of comments. I just thought I'd tell you, Carolyn Hayden said, or what they're exposed to. I guess that was something that we were talking about. And then Ellen Park Mork, I'm sorry, I hope I didn't mess the name up. She said she thinks it's pretty easy to tell if you have a dog from a puppy mill, but she was told by the rescue. And actually I want to, I should have started this. I can start this later. I don't know if it's actually easy to tell. I don't know about you. Do you think it's easy to tell if dogs come from a puppy mill?
I think that unless it's really hard to check. I mean, what you'd have to do is you'd have to meet a bunch of dogs and say, this is a dog from a puppy mill, get some idea of the behavioral responses that you see in them, and
Right.
then identify those as sort of being classic responses that you would see in a puppy mill dog. But I think that we also see those same kind of puppy mill behaviors in dogs that didn't necessarily come from a puppy mill.
Right.
So, I mean, unless you can actually make your best guess and then check it, then who knows, really? I mean, you can make that guess and say it's like, but here's the thing. This is the thing that to me is most, it doesn't matter. It doesn't matter. It only matters so much in that it helps us sort of gauge our expectations for the dog. Otherwise, we do not handle them. We do not train them. They do not learn any differently than a dog that didn't come from a puppy mill. So it is helpful if we know that because it can, if somebody says to me, I just got this dog, it was a puppy mill breeder, she's 4 years old, I want her to be my therapy dog. I might say, hey, you know what? Maybe not the best dog for you to be adopting to be a therapy dog.
Right. You know what? I thought that same exact thing. When my father was in the hospital, I thought, oh, he's going to be a great therapy dog. I swear to you, that's what I thought. Worse. I mean, that I went through all of this, because he was totally shut down so people could touch him even though he didn't want to be touched. I thought, oh, he's going to be a great therapy dog. What did I know?
Yeah.
There you go. And they're not. I can't say that all of them are like that, but yeah.
Right. Well, again, if you were going to try to make a reasonable decision as to what dog to get to be a therapy dog, you would not get a dog that was born into a puppy mill. Again, does it happen that some of them, can rise to the occasion? Sure. But is it reasonable? No. It isn't. But again, what it goes back to, that just changes our expectations for the dog. It doesn't mean that we train them any differently. They don't learn differently. This is an important thing, is that all animals learn the same way. Behavior itself is lawful. So the way animals learn it's the same across the board. And when you understand this, you can apply that to any animal that you work with. It certainly helps if you know the particular species better. You need to know your species, you need to know your individual. But as far as the way they learn, puppy mill dogs learn the same way that dogs learn that came from, the greatest breeder or, the street dog. They all learn the same way. So,
right. I'm hearing some feedback. Sabina, I think you're in the phone call. Can you join us on the Facebook Live? I don't know if she can hear me.
Can you hear me?
Yes. Yes.
Hi. I was trying to, and I'm having some problems, but I will continue to try.
Okay. Yeah, because then I can get you in, because it's important that people hear your story as well. So, but I'm going to mute you on the phone here because there's some feedback.
Okay.
So, whoops. So just so you know, Sabina is with a rescue group that it's mostly puppy mill dogs. So I thought she would be a guest here for a few minutes if we can get her in. If she can get in, I'm not sure if she can get in. So we have a couple of questions and a couple of comments here, if you don't mind. Somebody asked, Shana asked, please talk about fear aggression.
Sure. So when we look at the fear, a fear response. So fear is, it's a response to the environment. There's something happening in the environment that the dog is afraid of. And there are autonomic nervous system responses to being afraid. One is, you see this, there's that kind of like startle, we see the startle effect. We see often freezing where the animal doesn't move. Mm-hmm. So that dog that, oh, look, he lets me pet him.
Right. That's
right. We think, and we may think that dog is less afraid than the dog who behaves aggressively. But you have the dog freezes up. You have an animal who tries to get away. They just panic. All of those notices that you get when a new dog goes into a home and then runs away. Right. They're lost. Do not chase. What happened to that dog? They got startled and they fled.
Right.
The third is aggression.
Right.
They fight.
Right.
And so so when you have a dog, now those are all, some of them may be they're just automatic. They just happen. That's what happens. You reach, you go to touch the dog, they bite you, you reach, they run away. You may see differences based on a learning history. So street dogs, you try to catch a street dog, good luck to you. They run. They've learned to run since they were puppies. They will run. You have a puppy mill dog who maybe running was never an option for them, right? They couldn't get away. They were in a cage. So what do? They freeze.
Actually, mine did both.
Or if you get, again, this is just in general,
Yeah.
saying that there may be some learning history there. And the last thing we ever want to teach these dogs is to bite, is to behave aggressively.
Mhm.
And when I go back to why it is so important we need to keep these dogs feeling safe, is because we do not want to teach them that they should, to teach them to bite. Because if they don't feel safe and they can't, they don't run and they don't freeze and they bite, well, guess what? Biting often works, right? Your dog bites me, I back up. I'm not gonna keep going. I mean, some people do it with little dogs, but my attitude is if you wouldn't do it to an 80-pound dog, don't do it to an 8-pound dog.
Mhm.
Doesn't matter. So that's what you're looking at. So when you're looking at fear aggression, you're looking at an animal who is responding out of fear. And
Right.
this is, so I don't know what else, what more the question, I don't know where to take that, but the answer is don't put them in the position where they feel the fear that may evoke the aggressive behavior.
Right. So we had a couple of other questions. You're busy. You're quite popular here. You're bringing in the people, which is good. We like this. So Shayna also said these behaviors can happen from a puppy, from a breeder.
Sure.
And then Debbie Gannett, I believe her name is. I'm sorry if I'm messing up names. I don't know if you can read it there. So it says, what is the best way to break up a scared mama from a puppy mill? She bites and flails around when she's picked up. She's really scared to be coming around with potty training and being petted.
Right.
There you
So, right. So here's the thing. Number one, they need to feel safe. And they need to feel safe, however, they need to feel safe.
Mm-hmm.
And if that means that you don't touch them, you don't touch them. If they're not comfortable being touched, continuing to touch them, as we know, as you keep taking the dog to the training class, it doesn't get better. So this idea, this is where it's really important to understand this idea that they will just get used to it. We're thinking about habituation. It might happen. But if it doesn't happen, what we end up doing is actually making the problem worse. The animal, instead of getting used to it, instead of desensitizing to it, sensitizes to it. And so you start to get more, you might see this aggression. They might start biting. Number one, they need to feel safe. One of the problems, then what we come into is, well, how do I manage them? I mean, people say, well, I got to take them out. I got to toilet them. I got to, the thing is that this is where, and I know that people here have the answers. They know how to do this. You manage them so that they feel safe. If that means you set them up in a room with a toilet area with pads and papers, and you just leave them alone. If they're afraid of you, leave them alone. If they're afraid of other dogs, don't let your other dog near them. If they're comfortable with other dogs and you have the opportunity to have other dogs around, because we know some of these dogs feel safer with other dogs around. They like other dogs. If you can get other dogs with them, that's great. But there's no way around this piece. Okay, this is the piece that's the hardest for people to wrap their head around. You cannot make them feel safe. You cannot force them to feel safe. They just have to feel safe. So that's step one. The second step is we begin to create positive associations with everything we need them to feel good about. So that means if they need to feel good about me, guess what happens every time I walk in the room? Chicken falls from the sky. Cheese appears. Wonderful things. Whenever the lady walks in, food happens. Nothing bad happens. I don't touch them. I don't pick them up. I just walk in. The food happens. I leave. I don't sit there with them necessarily trying to feed them. If they don't want to come near me, I walk in. And what I'm looking for is that when I walk in the room, the animal perks up and goes, oh, there's going to be chicken. Where's the chicken? And then I know, bang, I got you. I have you. Now you look at me and you feel chicken. You all know the story of Pavlov's dog, right?
Right.
They ring the bell, they salivate. The dog, I walk in the room and the dog goes, I don't know why, but I feel like roasted chicken. This lady makes me feel like roasted chicken is about to happen, and it is. I make them feel good. Now I've changed how they feel about me because I'm the trainer. I'm the one that they have to feel good about. Or it could be, it may be that a dog walks in the room. Well, that dog makes chicken happen. Doesn't have to come from the dog. It just falls from the sky. We do the same kind of thing with noises. You know, what does that sound mean to me? That sound means chicken's going to happen. So that's step number 2.
My dog just heard you say that and started barking.
Heard me say what?
Chicken.
Chicken.
I'm actually vegetarian, so there's that.
Well, exactly. And that's the thing. We do that with their name, right? How do you teach a dog their name? Fluffy, chicken, Fluffy, chicken, Fluffy, chicken. What happens the next time you say Fluffy? Fluffy comes running over to where the chicken happens. We've just created a positive emotional response.
Right.
We've conditioned this emotional response to their name, to us. That's the second step. You know, again, they're not in order necessarily, they overlap. The third thing is we start training, and we use food to train. And I cannot teach you how to train here. Training is based on operant conditioning and how behavior works. And that we train dogs based on, many of us have done it with kids. You've taught little kids how to walk. You teach little kids how to swim. You teach people how to knit. The progression, the step-by-step systematic nature of it is something that we basically do the very same thing, but we look at every single behavior. So I have a dog. I have one of these dogs, and people say, well, I've got to get him outside. Well, what does going outside look like? Well, I have to put a leash on them. Okay, let's teach them how to have a leash put on. Let's teach them how to feel good about leashes. Let's teach them how to sit still when a leash goes on. Let's teach them how to walk on a leash. If they can take 1 step on a leash, we can teach them to take 2. If we can teach them to take 2 steps on a leash, we can teach them to take 3, and we can teach them how to walk out of the door. We don't drag them. We don't have to necessarily, be using food all the time to coax them. Not that we don't use food sometimes to lure them, but we basically, training itself this is where you need to find good trainers who can help you. And you can learn this. People can do this. One of the things about, I think, a lot of folks who have handling experiences, you got good reflexes because you managed to, you got good reflexes and you have good instincts. Now you need to just get this information about how behavior works and how to increase it, how to decrease it without using punishment, without scaring the dogs. And y'all can do this. But those are basically the 3 steps. They feel safe. You create good associations with everything in their world that they're going to be exposed to. And then you give them the skills they need to live in their world. And
right.
That's where the foster caregivers are just our gold, because they are going to be the ones that can help these dogs learn to come when they're called, learn to walk on a loose leash, learn to sit quietly, learn to go into a crate, learn to get into the car, all that stuff that they can be training, so that when the dog goes into a home and you have a lovely pet owner they're happy to take the dog, but they don't necessarily have the skills to train the dog.
Right.
You send a dog out there with the skills. They look at people. I used to joke, I had a border collie, and we used to joke and say he never met a person he didn't think could throw a Frisbee. He looked at everybody out there and said, and we used to joke and say, take him home. He's yours. Just take the Frisbee with you. And that's what we want to do with these dogs. We want to help these dogs look at people and say, I know what to do. I'm going to sit, and I bet this person is going to give me chicken. I know what to do around people. And sometimes, again, it isn't fast. It takes time. It takes consistency. But the better you are at it, the easier it is for these dogs to learn.
So we have a few more things, but I want to open it up a little bit to the conference call people, because we did have a few names pop up here. If you don't mind, I'm just going to
go ahead.
open up, see if there's any questions. I have some people. Joan, do you have any questions at all? Can you hear me okay?
I do not have any questions, but I just want to say I tried to join it through Facebook Live and couldn't make it happen. So.
Yeah, I think that, well, it's there now. So, and I'm going to do, I'm also going to do a movie watch, I think is what they call it. So I'll do that later. So you'll be able to watch it later. I unfortunately don't have it recorded on the conference call. So I'm going to go ahead and mute you and see, I don't know who the other person is there's a couple people here.
It's Patty. I joined in a little late too. I apologize.
Patty M? Is this Patty M?
Yes.
Do you have, well, there's somebody else who joined too. I don't have a name on there. Patty, do you have any questions at all?
Well, I don't have a question as much as just an observation. I've used the method that you're describing, with other dogs, and it has worked, but it never, ever, ever worked with Alvin, because when he's stressed, he will not take treats at all, no matter, we used filet steak one time, and couldn't even entice him with that.
Great. I don't mean great. It's you've a great segue into an important piece here. And part of helping the dog feel safe may be that we talk to vets or vet behaviorists about medications.
Somebody was asking about that too, so we'll get
to that. And that is, we currently, there's more technology all the time. We're getting more information. We're getting more products that are out there that can help us. But currently, among the best technology that we have comes from our vets and our vet behaviorists, and then really good trainers who can help us, get behaviors quickly with the least amount of stress on the dog. But yes, medication can make a world of difference for many of these dogs. It's not a quick fix. It's not a magic bullet, but it is one of those pieces that for some of these dogs, because of what's going on with them, the chronic stress and anxiety that many of these dogs have lived with since puppyhood, since they were born, has changed their brain. Chronic stress changes a brain. Their brain is developed in this soup of cortisol and stress hormones and adrenaline and whatever else. I don't really even understand it all. This is where we use our vet behaviorists for this. But their brains are different. And one of the things that we can go in there, and this is what vet behaviorists study, is how can we go in there and manipulate the chemistry of their brain to lower their stress, lower their anxiety, make it easier for them to not feel panicked, not feel fear and anxiety chronically. I also think not only does it make sense from a behavioral perspective. It makes life easier for us. Even if you are a professional trainer, you want to sort of stack the deck in your favor. So you want a dog who is probably, who's less anxious to work with. But also, to me, it just has to do with welfare. It's a quality of life issue. If somebody came to me and said, my dog has a broken leg, or they've got, their teeth are rotted, we'll do something about it. We have the technology. Are they in pain? If an animal is in pain, when I go to the vet and my dogs have to have something done, I have to sign a waiver. Will I allow the vet to administer a pain medication? I never say no. Of course you can administer a pain medication. Why wouldn't I give my dog a pain medication? If there's medication to help relieve the suffering of my dog, I'm going to go for it. And the same thing is true of an animal who's experiencing chronic fear and anxiety. If we have the technology, if we have medications that we can use to address that chronic anxiety, that chronic fear, that suffering, why not take advantage of it? So,
yeah. Do we have any other, I think there was one other person, I don't know who you are, but from area code 905-697-3362. Do you have any questions?
No, I don't. Thank you very much.
Okay, so I'm going to mute the rest of the calls. We have two trainers on here. We got Sabina and Jenny, and but I think they're here to listen. I know I was trying to get Sabina in here, and Jenny, you're more than welcome to join us on the Facebook Live if you can.
Hi, Jenny. Jenny's moved. Where are you, Jenny?
Jenny's in
I'm in Santa Fe, New Mexico.
Oh, how fabulous!
Hey, Jenny, if I send you the link to get in, do you want to come on to the Facebook Live? Not to put you on.
I don't think I can because I'm just on the phone.
Okay. All right. That's fine. You can watch it later. And
I could try on the phone, sure.
Okay. So let me send you a link right now. So you know, hold on one second. And then we get a bunch of other questions that people are asking here. Jennifer Grant, there you are, Jenny. All right, let's see if I can get this. Oh no, I sent the wrong link. Don't look at that link. Hold on one second. Let me. I know it's all this technology, right? And we don't know how to do it. Okay, so let me send this again. All right, here we go. I just sent it to you. So if you can get in, that would be great. So we do have some other. And I'm going to mute you, Jenny, if that's okay. We do have some other questions and comments. So Ellen said that Cassie freezes. We talked about this. Cassie freezes if she can't get away. Most people think it means she doesn't mind them touching her, but that's not true at all. And I think we kind of went over that already. And then Shayna also said your opinion of Prozac treatment or anti-anxiety medication, which we've kind of done as well. And it looks like we're doing a lot of covering here.
Well, and I should say that folks are familiar with Prozac. I mean, it's sort of it's out there that you should be aware that vet behaviorists use. They have many different medications that they use. They use medications in combination with each other. There are supplements that they sometimes add to medications. It's not a one-size-fits-all thing, and that I think that when folks get into it, that's something that they are aware of.
Right.
That it may take time, that sometimes we have to adjust dosages, sometimes we have to address maybe change up medications, and you want to do that with a vet. I mean, that's really important. I'm not a vet, so I shouldn't, I'm not saying to people, hey, y'all need to go put your dogs on drugs. But you should. If you work with this population of dogs, you need to find a vet or a vet behaviorist who is willing, or that you can consult with to help you, because this is the sort of thing that these are the people we go to, that when we are starting a dog on meds, we want to be able to talk to them and say, hey, look, this is what I'm seeing. I put my dog on these meds and they haven't eaten in 2 days. What should I do? Because we never want to change drugs or stop drugs without going, through our vet or vet behaviors, because these are the folks who know who might say to us,
what's happening here? That was weird. Are you there?
Hi, it looked like somebody was in their car.
Yeah, I think it is, but I don't know. Maybe you could put it on mute, Jenny. Let's try that. Let me add her on there. But then I don't know if we can hear her. She might not hear it. Why don't you just take it off? Okay, does that work? And then she froze. I don't know. How's it? Are you both frozen?
No, I'm not frozen.
Okay, Jenny, I think you're frozen. I'm going to put you back in. Do you want to try and get back in again? Let's see. Sorry about that, folks. I didn't mean to blast your ears here. Technology. No, she's not coming in. It's not coming up. Okay. Well, we tried. Maybe we can try again in a little bit. So we do have a bunch of other questions. Yeah, she's out. Okay, she got out. So this is my dog. That's my dog. Wants to be friendly, sniffs, licks, and then backs away and shows aggression. That's fearful, right?
Well, I mean, here's the thing. We make an assumption. Sniffs, the assumption that we're making, again, I haven't seen the dog. So, it's sort of trying to, one of the things about the way that we do assessments on behavior is we can talk about this, but the other piece of it is to actually, we need sort of, anything I say, basically what I'm trying to say is anything I say is just sort of, it's my best guess.
It's a guess.
Right. So, but one of the things is people assume that a dog who sniffs and licks wants to be friendly. I mean, that's an assumption that we're making, and that maybe they are, maybe they do want to be friendly. Maybe they're just coming over and the licking, I don't know whether we're talking about a little lick or we're talking about sort of that kind of greeting licking that dogs do to people's faces.
Right.
So I don't really know what the behavior looks like, but then what often happens is that dogs will possibly, that some of them feel comfortable coming over, but they don't necessarily want people to touch them.
Right.
But for us, that's like you've come over to, that's what we assume. We assume that any dog that approaches us wants to be handled.
Right.
And that's
exactly what my dog does. He goes and smells people. They go to reach over, which is like the worst. I always tell them if they want to pet him, it's either on his rear end or under his chin. And that's it. And that's all he can handle. Yeah. But when they reach over, he backs, or he'll bite.
Yeah. And the problem is, and this is sort of brings up why we don't necessarily want to lure dogs close to people to get food, because sometimes they'll come over and they'll take the food, and then the person reaches out to touch them, and you're lucky if they just growl and back away.
Right.
Because again, this is, those of us, we have to always remember that those of us who work with these dogs sort of have a sense, whatever we have experience with them, people won't necessarily know this, and they will think a dog that comes over to them wants to be touched. They reach out and touch the dog. Now the dog has bitten them, or growled at them, or snapped at them, or scared their kid, or scared their dog. Maybe now we've scared somebody else because we didn't manage them so that everybody continued. Not only did the dog feel safe, but we didn't keep everybody in the picture safe either. And that is sort of a responsibility that we take on when we work with these animals, is that we really have to keep everybody in the community safe.
Mm-hmm. So we do have a lot of questions here because you are really popular. Angela said one issue she has with her dog is marking, and he now wears a belly band, but he's not getting any better. Is there any way to stop this? Can I tell you, I had a belly band on my dog for the longest time. He didn't mark. He squatted and peed.
Yeah.
He would actually pull his little pee-pee out so he could do it.
Oh, the little bugger.
He was a little bugger, so we stopped doing it, and we just put down pads. But in your case, if he's marking furniture, I'm assuming that's what he's marking. I don't know. Do you have any ideas for that, or is that something totally different?
Well, I think what we're getting down to is, I suppose one could ask, do we think that that there's an underlying kind of anxiety where some dogs will go around and, out of maybe they're feeling anxious and they're sort of urinating for that reason. I don't know. But, we can look at it from just basically the house training perspective, which is, are we controlling the dog, managing the dog so that they don't have access to peeing on places we don't want them to pee? Right. Is the dog house trained? Are we giving them, are we getting them out? Or have we house trained them?
I would also put in there to have them checked out by the vet to make sure there's no medical issues. I mean,
Right, exactly. Are we reinforcing urinating outside? So we would have to sort of pick it apart. Is there a medical issue? Do we think we've got a dog who's really anxious and maybe there's something about that going on? Maybe not. Or is it one of these just sort of really? There are some dogs that are very, very hard to manage in that way. There are some, like you're saying, there are some dogs that where I brought a dog home. He wasn't house trained. He was just, I think he did. It was like a recreational marker. It was what he did. It was sort of like his daily activity. I think I'm going to go and pee on stuff. And I'd sort of watch him toddling around and sort of pee on things. I think, oh, what is this? And I, worked on the house training. He wore a pad in the house.
Mm-hmm.
I do have other dogs. Which I'm sure is, part of the picture. So I think, as far as, can we resolve the issue? In some cases, I think we can, if we focus on not letting the behavior become rehearsed,
right?
Not setting up the conditions that sort of prompt a dog to urinate in the house.
Right.
But then there are those, little dogs that walk around with that.
What mine did, and he always would go in the same. We were lucky because he always goes in the same spot, so we would just put pads down. This case, when you're marking, it's a lot harder to do, but I feel her pain.
Yes.
So another person, Catherine, who I know, she was saying that flooding can work if they're young enough puppies.
Well, I would question what young enough means. And basically, young enough is probably, again, I don't know that there's, I would first ask to see the research done on this, that, where the data is coming from, that, where the cutoff is. So what is young enough, can work. And I would say that just sort of anecdotally, where and again, this is anecdotally, and I don't know that there's the data that we could say, oh, the dog is 4 weeks old, 5 weeks old, which is really when they are sort of, we're getting them where their brains are sort of open to everything. They're open to learning to deal with their environment. They're learning, they haven't quite that fear response that starts to kick in when they start to go out. You start to see it around where they start to go out into the world, 8 weeks old or so. You get a dog after that, and I would say, be careful. If somebody's saying, flooding works if an animal is young enough, I would say, what does young enough mean?
Right. So Shayna also said, good to hear that other people are dealing with this situation. Debbie, and Shayna also said, can we get a group together to help each other? I will come into your house with chicken if you'll come to mine. That's what I did. I started a local meetup group. So I don't know, Shayna, if you're in the DC area, but that's what we did for a while. And that might be something you might want to do, is start up a local meetup group for puppy mill support and have people come over to your house, or just, that's just something I'm offering. Or go to a lot of the shelters will do stuff, but then you have to be careful. I guess I shouldn't really recommend anybody, because you have to be careful who you're using. And then now Debbie said, let's put her post up here. She said, great advice. That's what I've been doing. Getting her to trust me is first. She's allowing me to pet her when she's in bed. I never thought about feeding her chicken. We'll try that too.
There you go. That is anything you want a dog to feel good about. Makes chicken or cheese or, whatever the dog loves happen. So it may be you pet feed.
Yeah, Jenny's always said high value treats is what she's always told me.
Exactly. Great advice.
The good thing with my dog is any treat is a high value treat.
Perfect. Perfect. Kind of like me.
Yeah, me too. And then Ellen said, I love what you're saying. I was told to push Cassie. I thought it was wrong in the beginning, so I didn't earn her trust at first. Okay, so then Shana has asked a question. Where can you get a list of vet behaviorists?
It's AVSAB. Let me AVSAB.org. Av,
Okay,
uh,
sab.org. Okay,
yeah, check it out. See if that comes up for you. Are you able to pull that up?
avsab.org. I'm putting it in the list.
American Veterinary Society of Animal Behaviorists.
All right, let's see if it works.
AVSAB. Let me put it in the chat here for you if you can see it. That's
Yeah.
how I remember it. They will have a list. There's not many. There's not enough of them, but there's going to be more. The other thing is that if
The link works, so it's fine. We're good.
okay, and if you're not, there's not many of them. Some will they will do consults with a vet. You know, you can find some who will do they'll chat with your vets. There are some that will do an online consult with you, but they will not prescribe medication. That has to go through your vet.
Okay. We have a few other quick questions here. We're almost out of time, unless you're willing to, because boy, we got a lot of questions here. All right.
So I see this question here. Meds can be prohibitive with rescue budgets. It's not so much that the meds can be some of the cheapest thing you can go to Walmart and pick up a prescription for Prozac for $4. It might be the vet costs or the vet behavior costs.
Right.
But here's the thing that always sort of gets me. You go online and you will see the dog with the broken leg. You know, help us help Fluffy.
Oh, go
was hit by a car. We will put this money, and those dogs deserve it. We will spend the money. We will go and fundraise for dogs who have physical problems.
Your group does.
Well, no, I mean just in general, like the dog community,
right?
We'll do that, and yet we don't tend to value the importance of spending the money for these behavioral issues.
Right, exactly. Okay, got it.
Yeah, but I do understand. I mean, I do understand the problem.
Yeah,
and that my little barker there.
I hear him.
Well, that's my little peer. So I'm just going to run to the door and let him out. Excuse me, because that's my little boy who came to me as a little marker. So he's barking at the door. So I'm going to let him out. I'll be right back.
Okay, good. So in the meantime, I'm going to post this one. I think Cheryl posted this. What about alternative medicines or methods like healing touch or Reiki? I'm going to ask Debbie about this. But while we're waiting, I'm doing a shameless plug for you.
Thank you.
You can get it on your website. Is that right?
Thank you. Yeah. Thank you.
On Amazon. I just checked on Amazon.
Yeah. Dogwise has it.
I've had this book for probably close to 10 years now. So
yeah, it's about how long it's been. There's another one called "Does My Dog Need Prozac?" and it's just a collection of stories and short pieces about dogs. But anyway, thank you for
doing the plug. I have to do it at least once. And if you missed the beginning of this, I'm going to try and do a watch afterwards so that you can ask questions and I'll try and answer them, or I'll have Debbie answer them at a later time. But it's worth watching this all again and sharing this out to anybody you think might need this. So Cheryl asked, what about alternative medicine or methods, healing touch for animals, or Reiki? I don't say it right. Yeah. Reiki for animals. Yeah. I've done that before, by the way, for both myself and my animal.
I'm going to be. I know that people. I tend to go with the treatments and the products that actually have research and evidence indicating that they actually do provide the kind of outcome that we're looking for. The reason for this is that there's lots of anecdotal information out there that, this worked for me, and so, I'm going to give it a try. And the reason why this is my preference, and that goes with, medications or vet behaviorist prescribed supplements or how do we say this word? Nutricicles, the supplements that we add to food, whether it's probiotics or whatever, that we go with those things because for a couple of reasons. One is that there's evidence to support it. There's lots of stuff. What happens is that when you start trying, well, I think I'm going to try this. The clock is ticking. Well, that didn't work, so I think I'm going to try this. The clock is ticking for these animals. It's sort of like I have a headache, or, I've got this, I'm having a migraine. Well, here, let's do this. Okay, well, that didn't really work. There's no evidence to support that it works, but let's try it. Well, it didn't work for you, so let's try something else. Meanwhile, my head, I'm suffering. But there's this product, as a medication or whatever, a treatment that we have evidence for that shows that it works. We know how much to use. We know the quality of the product. We know where it's coming from. Which is one of the products that we have with a lot of these, whether you call them alternatives or herbs or whatever, is that there's no quality control. We don't know the dosages. They've never been tested. And we can spend money on those things. You can go to a pet shop and you can I call it death by 1,000 cuts. You can go to a pet shop and you can start pulling stuff off the shelves and spend hundreds of dollars easily. By the time you're done, $20 here, $15 here, $30 here, and you're meanwhile keep adding it to the adding machine, and it's going up. And then I may go to somebody and say, well, go to a vet, go pay a trainer that knows how to work with these dogs, go get some medications, and then we say, but that costs money. Yeah, but that's where you want to put your money. Put your money into we need to be reasonable about this, because every time, if I send somebody off and I say, well, try this, flower essence or this herb or this whatever, and there's really no evidence to support it, then I just see it as sort of like we just can, we're bleeding money. And I think that if we're going to do it, that we should do it using evidence, using good evidence-based training and evidence-based medicine.
What about things like CBD?
Well, it's a good question. We do not currently have the evidence to support it for anxiety. We do have evidence that it's helpful for some pain-related issues.
Right.
For I think maybe for appetite related issues, but you're looking for the evidence. It doesn't mean that potentially we won't have the evidence. Again, it's not the question that it isn't, but we need to be smart about this. And that right now we have people, and it's expensive. You talk about meds being expensive. Quality CBD tastes bad and is expensive. And the problem is when you go to the store and you get, the treats with CBD in it.
And it takes a while, but it does take a while for it to use. I use it on myself, so I do know what works for me. But, it's not something that, it's not something that works right away. Like when you take Tylenol or baby aspirin, that's going to work in an hour. It doesn't. It takes time, for it to build up to work. So,
well, and then the question is to do what?
Right.
What are we using it for? And there is no, and in fact, you can talk to a vet behaviorist now. If folks here in my Fearful Dog group know, we have vet behaviorists in our group, and they will say, please, there's no evidence to support that CBD should be used for all of the things that people are out there, using it. So again, it's just sort of my pet peeve is that we need to take the handling and the training and the treatment of these dogs as seriously as we can.
Ellen, Ellen said that she believes that dogs should be allowed to growl.
To growl.
Yes.
Well, allowed to, they do growl, but I know what she means. And I think I think the point that she's trying to make, and correct me if I'm wrong, Ellen, but I think the point is that dogs should be able to say, no, thank you. The growl says to us,
No, thank you.
no, thank you. No, stop right there. And that's reasonable, because if I say to a dog, you can't growl at me, by punishing them, or even if they're growling, just continuing to do what I'm going to do, well, we know where that can go, right? So sure, if a dog, my thing is try not to do something that makes a dog growl. How can I behave with a dog so that they feel safe enough they don't growl at me?
Right.
They look at me and go, oh, you're pretty cool. You give out treats. You play ball. You throw frisbees. But yes, I agree. Dogs should be able to do all kinds of communicate the way that they do communicate.
So we have, let me go back here. Cheryl said that you can train your dog some basic tricks like spin, target, touch, and sit, pretty much to help maintain focus of the owner while out and about. I'm not sure where. I mean, I was able to teach my dog all that, but inside the house, I couldn't have him do it outside.
Well, I think that there's different ways that we approach working with these dogs. A lot of people will work with these dogs in basically sort of trying to distract them, sort of keep them distracted from things out in the environment. And sometimes we do that. I mean, sometimes distracting them is a way to deal with them. But preferably, I think is, and not that there's anything wrong with teaching your dog to do all those things. That's great. Why not? Fabulous stuff. And if you can use them outside, but and this may not be, I may be jumping to a conclusion. This may not be what she means, but rather than trying to keep a dog distracted when they're out in the environment, instead teach them the behaviors that we need them to perform out in the environment. And maybe it's just keep walking, or this is what happens when you see this particular thing, or this thing happens. So there's certainly value to using distraction, but it's different than training. So
Right.
We may train a dog and use certain things to distract them, right? But that's different than training them in that environment so that we don't have to worry about distracting them. They're in the environment and they see things and they go, oh, that thing. Okay, let's keep going, lady.
Yeah. No, mine does all the tricks at the same time, but he's better at doing it inside the house. I can't really do it outside. So somebody said, can marking in the home also be considered displacement behavior?
I don't know. I don't know what she means by displacement behavior.
Well, Dylan, if you could post below, and we can either, once we're over, we can respond to it later. And Dylan also said, going back to the vet, let's see, behaviorist is the general rule that all vet behaviorists practice a force-free approach, or do you think there's still some vets preaching dominance, alpha training corrections?
Well, I would say amongst vet behaviorists, no, because they're behaviorists. They understand how behavior works. And so all of that other stuff, first of all, it's just sort of mythology. It's not based on how behavior works. And it would also be counterproductive. So among vet behaviorists, no, we don't. I wouldn't expect to see it. Not to say, again, I haven't talked to every single vet behaviorist out there, but I wouldn't expect to see it in vet behaviorists. Now, vets are a different story. Vets have a big job. Vets have a huge job. They have to learn to work with different species. They have to understand, a variety of different systems, to then expect that every single vet is also up on behavior and training. I mean, I think often there are vets out there that we know are possibly not necessarily skilled in those areas. And hey, again, they have a lot on their plate, but that's where those of us who are trainers, we work with vets so that our vets can help support our animals medically. And this is how I work with my vet. When they have clients who have behavioral issues, the vet works with them medically, making sure that the animal is healthy, that there aren't any underlying conditions that may be causing behavioral problems. And then I come in and I help the owner work the training plans. I show the owner how to teach the dog to do what they need him to do.
Okay. I think that's all for the questions online. Let me just open it up to the conference call and see. Does anybody have any questions on the conference call here? I think we got 3 people.
I do. It's Paula in Toronto.
Hi, Paula.
One of our biggest issues is dogs going over threshold. So once they get over threshold, they're either barking wildly or they're just not listening anymore, or they're shut down. And that is also a form of being over threshold. How do you work with the dog to start calming him down in the moment?
Well, it's sort of, I think it's a great question, but it's almost like the question of, I have a problem that kids can't swim. And every time I throw them in the deep end of the pool, they start to drown. How do I deal with them in the moment? Well, get them out of the pool.
Right.
You're already, they're in over their head. They're drowning. That's what that behavior is telling you. I don't feel safe. I'm in over my head. I do not have the skills. I'm panicking. I'm terrified. The best thing you can do there is mitigate the situation as best as you can. Get out of there. And then say to yourself, okay, what skills, what do I need to do to keep this dog feeling safe? How can I help this dog develop positive associations, whatever events are occurring in the environment? And how can I start to give them the skills that they need to be able to swim? How can I teach them to swim in deep water? Well, we don't start in the deep end, and you don't start in the ocean in 12-foot waves. And then you start in the wading pool. You give them the skills at home. You work with them so that they have these skills. And then, we take them out. We help them learn to generalize those skills under different conditions.
Does that make sense?
Yeah, but I guess we try all the time to make sure that they don't get over threshold and they're not in the deep end, but sometimes stuff happens and you're stuck.
Yeah,
you have a dog that's threshold with you, and you understand that it's a mistake and that you have stuff happens, right?
Yeah, and I get it. I totally
turn around and run away, which is a good methodology. But I guess what I'm asking is, are there exercises or things that you do to calm a dog down? And as I'm speaking, I also realize that it's very dog specific. So it may be hard to generalize that question.
Yeah. No, I mean, I do understand what you're saying, and it is a good question. Because what we look for, again, the dog needs to feel safe. If the dog doesn't feel safe, there's not a whole lot of, good learning that can happen if a dog doesn't feel safe. I mean, think about it yourself. Somebody's, you're trying to cross an 8-lane freeway, and somebody's trying to teach you how to, put in a phone number in your cell phone. You're like, hey, look, I can't focus on this stuff. I'm busy worrying about staying alive here. And so not a lot of good learning can go on there. We need to create the good associations. You can't have good associations if the animal is feeling terrified all the time. And again, that goes back to learning. But to go back, to sort of go back to, sort of where you might be getting, yes, there are things that we can do, but what we look for is is to give the dog the skills they need so that in that situation, they have, something that they've been trained to do so well. It may just be turn and look at the lady, turn and look at me, and walk the other direction. So that turn and go behavior is one that I actually work on. You can work on that at home so that when the proverbial, poop hits the fan, the dog has practiced and rehearsed the behavior. Look, we train this. People who work in, people who work in the military, people who work in law enforcement, they practice and practice and practice these behaviors. We do not send new novice firefighters into burning buildings with new pieces of equipment and say, good luck learning how to use it. They train and they train and they train in under all kinds of conditions so that when they're in that burning building, they have behavior that they know that they can, that they can fall back on. And that turn and go behavior is one that I work with. That look at me behavior. Just turn and look at me, respond to pressure on the leash. When you feel me give a little pull on the leash, you just turn and go. Come with me. Come on, let's go this way. And it's a trained behavior. Otherwise, again, you really just, once that happens, once the dog is either, pancaking on the ground, frozen, trying to get away, you're really just in damage control, in my opinion.
Yeah. No, I actually like that. That's, I hadn't thought of it that way, that it's a trained behavior. The turn and go is a trained behavior. Practice, practice, practice. No,
Yeah. Yeah, do it. They love it. Why not? You're going to give them chicken for it.
Great. Well, do we have any other questions on the conference call? If not, we're going to wrap this up. We actually went over a little bit more than we thought. Any last comments on the call? Okay. So, again, you guys know where to reach Debbie. She's at fearfuldogs.com. She also has you have a Facebook group page, correct? That people can join?
Yes. There's a group, Fearful Dogs. There's a Facebook page, fearfuldogs.com.
Yeah. So I encourage anybody who needs the help to join them. And I also encourage you to join our Puppy Mill support group because we do put out information. And we have a once a month conference call for anybody who is in need, especially the foster people. Please go to our website, which is puppymillsupport.com. I have to approve you before you get in because I don't just allow people with just anybody, but if you've got a puppy mill dog or if you've got a dog from a hoarding situation, or in another case, the newest thing is laboratory animals. Laboratory dogs are very similar too. We'd be happy to, have you come in and talk with us. And Jenny Grant is our trainer and she's awesome. I posted her link down below as well. And, we'll try and do this once in a while. I'm hoping that Debbie will come back and chat. Are you speaking anywhere anytime soon, Debbie?
The next thing I have coming up is in Vancouver, British Columbia, in April, early April, and I'll be posting that when I have the link to where folks sign up.
Okay, so you can send me the link and I'll post that up.
Happy to. Okay,
so thanks for joining us, everyone. I'll try and do this as a watch later, and I'll definitely you'll be able to watch the replay on my page on the Puppy Mill support group at any time, and you can share that link with any of your friends. And I want to thank everyone for coming in. And for those who are our regulars, we'll see you next month. And I think that's it for now. Thank you.
Okay. Bye.
Oops.